as we're speaking here and relates to colorectal cancer, we're looking at specialized physicians as well as other healthcare professionals that work collectively to help care for patients and their families in a most appropriate and proper sense. You have surgeons, you have medical care professionals, you have nurses, social workers, nurse navigators or social work navigators to help patients get through the system. You have, in my case, genetics, and the part of my role there for the care team is to provide genetic assessment for individuals and try to determine who may or may not benefit by genetic testing to determine whether there's a genetic risk to their cancer or there is no genetic risk to their cancer. And if there is a genetic risk to the cancer, who in the family might be at risk to benefit by further ongoing testing and care, and who can be reassured they do not have a gene, hence their risk for cancer would be no more than a general risk for the population. So I think the two things that would be most important is proper screening at the proper ages, following proper population guidelines for care, and know your family history, keep it up to date. If things change, risk could change, and we can then undertake proper assessment of the families genetically when needed. The majority of colorectal cancer occurs sporadically. Let's just say cells can go bad, not because of genetics, just because cells go bad. But in a percentage of cases, upwards of 5 to 6%, people will inherit a gene or have a gene within their family that's actually pushing those cells to go bad. There are a number of genes that can create what's called Lynch syndrome, and Lynch syndrome is a term related to individuals who have a specific gene that predisposes them to an array of tumors, predominantly colorectal cancer, but other cancers may be involved, such as the uterus, ovaries, other parts of the GI tract. They may actually have bone cysts or brain tumors, and you can get subsets of this Lynch syndrome or hereditary colorectal cancer.